Hi, Dr. Brad Harmon with Harmon Dental Center in Louisville, Kentucky. So the three main things that I hear people have concerns about when they're in here, one is how much time it's going to take, how much money it's going to cost, and how much discomfort or pain they're going to be in afterwards. You know, the surgery takes, we usually schedule about a half a day for surgery. So I would say to do both upper and lower jaw, full extractions, implants, and teeth out the door in probably 5 hours. Surgery is surgery. You know, it takes a little bit of time to get, and the planning is the planning, so that takes a little bit of time, but the time away from work is really minimized. By the time we get to the final prosthetics at 4 or 5 months, you can eat anything you used to eat with teeth. I find that when we do these kinds of procedures, the post-op complications and the post-op pain is really minimal, to the point that people can return to work sometimes even the next day. So one of the main concerns people have is cost, right? It's the money is what's on everyone's mind. And so the thing that I think a lot of people forget about is by the time they're a candidate for full arch implant dentistry, they've already spent a lot of time and a lot of money in the dental office. And so when you really add all of that dentistry up, it's likely more than you would pay to have the entire mouth rehabilitated with implants. The implant is a factor. What the quality of the bone is a factor. There's a lot that goes into it. We like to tailor specifically to a patient. We try to keep prices down by streamlining our processes. We buy a lot of implants at one time, so I can leverage the cost of implants and pass that savings along to patients. Yeah, we definitely have financing options, and a lot of people need those. We partner with Proceed Finance, who is very helpful in this area. They give a lot of our patients the resources they need to get the treatment done. So pain is obviously a fear for a lot of people. And so one of the ways we minimize that is through one good surgical treatment. And then we also make sure you're comfortable during the procedure. We have lots of different layers or levels of sedation that we offer, all the way from IV conscious sedation up to general anesthesia and a little bit of everything in between. So patients are comfortable during the procedure. When you do a full arch of implants and then you load it with a prosthetic, the prosthetic is carrying that load and not the soft tissue. It's the soft tissue that usually hurts. And so when you're not loading the soft tissue, your pain is minimized. So I find a lot of people can go home with just a normal over-the-counter analgesic, just pain medication over the counter. So for more information, call our office or visit our website, and we can answer any question you might have about dental implants.